With Father's Day coming up this Sunday, it's a perfect time to discuss some important men's health issues to make sure that our fathers live a long and happy life. But sometimes it can be hard to kind of separate fact from fiction when it comes to men's health. People's health urologist, Dr. Neil Baum, joins us now to set the record straight. Good morning to you.
Good morning, Greg.
All right, Dr. Baum, I'm going to say a couple of myths, and you can tell us if they're, I guess, true or false, okay? I guess this is how it's going to go this morning. First, men are more likely to get prostate cancer than any other cancer. True or false?
True.
Okay.
There are 250,000 new cases of prostate cancer every year. It's the second most common cancer after skin cancer, and it causes 30,000 deaths a year, and these men don't need to die because they could get a blood test and a digital examination and be diagnosed and treated.
Yeah, so if they were to get that screening earlier, they would be able to stop any of these problems from ever occurring.
Particularly prostate cancer.
Yeah, all right. Well, okay, here's another one. A man's age doesn't affect his fertility.
False. A man's age does affect his fertility. Men have a time clock just like women, and after the age of 40 and 50, their fertility goes down, but they still can have children. Just ask Edwin Edwards. He did a great job at age 80. So that you still can, you're not sterile, but the ability to have a child diminishes considerably.
Okay. All right. So pretty much false on that one. How about, once again, with prostate cancer, is it something that affects only older men?
False. Younger men under the age of 50 can develop prostate cancer if they have a family history, or if they're African American men, they need to start getting tested around age 40.
Okay, so by the time 40 years old rolls around, start thinking about these things.
Absolutely, and especially if you're at a high-risk group, you need to start getting tested earlier. See a doctor, get the blood test, get the digital rectal examination, and get diagnosed early, and you can be treated and cured.
All right, well, how about this? Osteoporosis is only a woman's condition.
False. It affects 2 million American men. Osteoporosis means brittle bones. You're at a high risk of falls and fractures, and this can be diagnosed by an imaging study and treated with diet, particularly calcium and other medications, and you avoid the risk of these very painful and deadly falls and fractures that can affect your hips and your spine.
How about this statement? Men can get breast cancer. Is that true or false?
Yes, men have mammary tissue. It's about the size of a quarter, and they need to examine themselves regularly, and if they have any lumps, bumps, or discharge from the nipple, they must see their doctor immediately.
Doctor, what do you think it is about guys that they're not wanting to get this stuff checked out?
We have an attitude, particularly in Louisiana, if it ain't broke, don't fix it. Well, that may apply to your car, but it certainly doesn't apply to your health. Men have to take good care of themselves, and our women have to help be responsible for getting the man to come in and get checked up regularly, just like my wife does.
Yes, very good, of course. Absolutely. Well, we appreciate it. Thanks so much. Dr. Neil Baum, separating fact from fiction ahead of Father's Day, and happy Father's Day to you.
And to you too, Greg.
Thank you very much.